Silace is a medication used for occasional constipation. It is often the first method used for preventing and treating this type of constipation. Silace works by increasing the amount of water the stool absorbs in the gut, making the stool softer and easier to pass. Relief is usually seen in 1 to 3 days with this medication. It is important to check the ingredients on the label, as the manufacturer may have changed them, and products with similar names may contain different ingredients meant for different purposes. Taking the wrong product could harm you. When taking Silace, always read and follow the directions on the package. If you have any questions, ask your pharmacist. Take this medication by mouth with a full glass of water or juice, usually at bedtime. The dosage depends on your medical condition, age, and how you respond to treatment. If you are using the liquid form, be sure to measure the dose carefully. Only use this medication when needed and do not use it for more than 1 week unless directed by your doctor. Do not increase your dose or take it more often or for longer than directed. If your condition gets worse or you think you may have a serious medical problem, seek medical help right away. If you experience stomach pain, diarrhea, cramping, or an irritated throat, it's important to tell your doctor or pharmacist. Your doctor has weighed the benefits of this medication against the potential side effects, and many people using it do not experience serious side effects. However, it's important to seek medical attention if you notice any serious side effects, such as rectal bleeding or signs of a serious allergic reaction like rash, swelling, severe dizziness, or trouble breathing. If you experience any other effects not listed, it's recommended to contact your doctor or pharmacist for advice. If you're in the US, you can report side effects to the FDA, and in Canada, you can report to Health Canada. Before taking Silace, make sure to inform your doctor or pharmacist if you have any allergies. This medication may contain inactive ingredients that can cause allergic reactions or other issues. It's important to consult your pharmacist for more details. If you have severe abdominal pain, nausea, vomiting, or sudden changes in bowel habits over the previous 2 weeks, it's important to talk to your doctor or pharmacist before using Silace. Before undergoing surgery, it's important to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, make sure to inform your doctor before using Silace, as its effects during pregnancy are unknown. It is also important to consult your doctor before breastfeeding, as it is unknown if Silace passes into breast milk. When taking Silace, it's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. This means it's crucial to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's also important to not start, stop, or change the dosage of any medicines without your doctor's approval. One product that may interact with Silace is mineral oil. If someone has taken too much Silace and has serious symptoms like passing out or difficulty breathing, it's important to call for help. In the US, you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. It's important not to share Silace with others. Make sure to keep all medical and lab appointments. To avoid constipation, make sure to eat plenty of fiber, drink enough water, and exercise. Remember, Silace is only meant for temporary relief of constipation, so don't use it for a long time to avoid becoming dependent on laxatives. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take extra to make up for the missed dose. Make sure to store Silace at room temperature and away from light and moisture. It's important not to store it in the bathroom and to keep it out of reach of children and pets. When it comes to getting rid of Silace, do not flush it down the toilet or pour it into a drain unless you're specifically told to do so. Instead, make sure to properly discard the product when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.